of these studies have shown us that by having a stem cell transplant in initial therapy, patients achieved deeper responses. More patients had negative minimal residual disease, so that we were unable to detect minimal residual disease after their transplant. And an example I've just used to illustrate is from the determination study. More than half of patients were MRD negative after their transplant, whereas only 40% of patients were MRD negative if they didn't have the transplant up front. And again, in all of these studies, there was a longer duration of first remission for patients who had the stem cell transplant in this first line of therapy. And this is an illustration from determination of the many years of remission that were achieved for patients who had the stem cell transplant as part of this initial line. But this isn't exactly the same therapy as I mentioned this morning we're now using to treat patients in first line. So we talked this morning about the combination of daratumumab with triplets as induction therapy. So these trials were not conducted in the time when we've been delivering that therapy.